Merry Christmas to those who celebrate. It is 5:58 in the morning. I am working today. I'm going to deliver some little Christmas babes. Some fun things planned for later. I'm going to take you along on a day on labor and delivery on Christmas. It's a Monday morning and obviously it's quiet for the holiday. It's weird, it is so quiet. It's usually so poppin' here in the morning. Never mind, it's gonna be a good day. Per usual, we're getting sign out from the night team, and then this is how I structure my postpartum rounds list. I can go into more depth if you're curious, but kind of sort everyone out, and then certain things I need to ask certain people, I'll make note of that. These are my co-residents who traded shoes for their overnight shift to celebrate Christmas, and then they are switching back.
Nope. Allow me to assist you.
Before seeing my posties, I always prep the notes just because it makes it much easier. After I go see them, I can just fill in the blanks with whatever we talked about, and that's it. It is now 7:49 in the morning. We had sign out from the night team and then just rounded on my postpartum patients. I did a vaginal exam on one laboring patient to see if we can start Pitocin to help move things along. We can. At 8 a.m. every morning, we have our board round, so we were heading to that, and then we got our breakfast, and we did have some downtime during the shift, surprisingly, so we printed out an ACOG practice bulletin, nausea and vomiting and pregnancy, and we learned about that just to kill some time. The nurses were having a potluck, and they were so kind to share some with us, so we ate and read. Just delivered a little Christmas baby, first one of today for me. I didn't wear my hat, but it was a quick and easy little delivery. So we have 2 other laborers right now, and we'll see what they do. They're due for a check now, actually, so gonna go do that. If you didn't know, I am a DO, and I learned OMM in medical school, and a lot of you ask if I use it now that I'm a resident, and I actually use it a lot more on my co-residents than I do on actual patients. We all have very similar complaints of our necks and backs because we don't have the best ergonomics during surgery or while we're charting, so we all have the very similar trapezius and levator scap pain, unfortunately, so I try to treat my co-residents when I have time. And then here I am finishing up on some charting before we got to leave for the day. It was a pretty nice shift. I'm done. Thank God. It was a good day. And now I can say the Q word. It was quiet. It's quiet and easy. And thank gosh. My baby's at home cooking Christmas dinner. So I'm so excited to be with him. And my co-resident and her boyfriend are gonna come over and we're gonna have Christmas dinner together. You guys, I did not even go to bed that late, but I am so tired. I'm exhausted. I cannot wait to be done with this week because I need time off. Like, I'm so burnt. I'm exhausted. Doing postpartum rounds. Oh boy. Did my postpartum rounds pretty quick. And then there's a patient that came in and triage the second we got here, and they're in labor. So I admitted them, and we're gonna expectantly manage because she's contracting great on her own. Pretty dilated, so I'm gonna get breakfast before it gets crazy. Not that we have a lot of downtime, but when I do like to practice my single-handed and double-handed throws, right and left hands.
Just waiting for people to deliver right now.
I'm so tired, it's insane. I am so tired to the point where I do not feel well. Like, I just feel sick, like nauseous and very lightheaded. I was like on the verge of passing out while I was delivering a patient, which was pretty scary. So tired that I'm still wearing these pink shoes and not my Birkenstocks. Dang it, I forgot to change them. Since clearly I was feeling like complete crap, I got home and Patrick had made me a cup of tea, and we just rested before the next day of work, where I was yet again still very drained and just running on complete fumes. I don't know what was wrong with me, but to top it off, I got pricked during surgery, one of our C-sections, and it busted through both of my gloves and drew blood. So we had to do this whole protocol where I fill a bunch of paperwork, and then I have to get my blood drawn, and the patient has to get their blood drawn to make sure that I'm not going to get any bloodborne pathogens. And it was a whole thing, but my lovely co-resident Jasmine drew my blood, and it was painless and fantastic, and she did a wonderful job. What is up? I'm here with my boo-boo, BB.
Me?
I'm here with my boyfriend, Patrick. You may or may not have seen him in my recent videos. Had him in there, and then he's also been playing the piano, so you may or may not have heard him playing so beautifully. We're in Chicago right now, and we've been here for the last week, almost, and we have a few days left here. I'm on my 1-week vacation. We're visiting his family and just enjoying ourselves and this time off. I've had a few rough weeks in residency recently, and I've kind of shown a little bit in my vlogs, and he's been staying with me. So I come home after these crazy days or rough days to him, and he's had to deal with some of my meltdowns or just me not feeling that great. I want to ask him some questions about how he deals with me in residency and when I have rough days and things like that. I know what he does to help me feel better, but I want him to also share with you guys. I know that there are some of you that have partners in medicine or are curious as to how we operate a relationship while I'm in residency and he's not in medicine. I wanted to kind of just talk about it and ask him some things and then share with you guys, and it may or may not help you. I'm nervous and I don't know how to phrase it. First, as a general question, how is it being with someone in residency?
Yeah, I think there's a perception that I've seen a lot of people in some of the comments on your videos assume, oh, you know, it's got to be hard or it has to be a certain way. And I think anything is hard in, you know, anything worth doing, which is obviously overstated, but I don't feel like I'm doing anything or that you're doing anything that isn't exactly what should be done. I think that, you know, if I felt like what you were doing was taking away time from me or something, I think that there would be deeper problems, and that's a bad mentality. So I've never once felt like, oh, Rachel's off working and not with me. I'd rather you be doing that, because the alternative is neither of us are doing anything, and that's pretty boring and horrible. So I never feel like it's a burden or anything that I'd rather you do anything else. It's just what it is, and it's not hard for me.
Good. I'm glad. With so much of my time being in the hospital, and I experienced so many things there and somewhat traumatic things, I guess, or just working a lot and being really tired, I come home, I'm not feeling great, or I'm sad or upset about something. What are some things for someone else that maybe is in your similar shoes dealing with someone like me? Like what do you do, or what can they do to help their partner if they don't know how to, you know what I'm saying?
Yeah, I guess, you know, and then maybe correcting something I said previously, that might be the hardest thing, is when you're in a place that I'm like, I can't, you know, fully understand. You've obviously learned a ton of stuff and do so much that I've no real concept of, and I can't go, yeah, here's my thoughts on it. I think that's difficult. You know, it's such a specialized field where I think, you know, what I do professionally, I could go, it's this and that, and I think you get it, and it's usually yeah. And, you know, you'll have to explain things like I came from a different planet sometimes, and that's difficult. And I know that I can't, you know, give much, you know, to you other than hopefully being there and just being a space of, you know, peace. You know, I know, like, starting to spend more time at your house. I wanted to do little things. I'm like, you know, this is comfortable in my space. If it's lighting or whatever, or candles. And I think if you could do that and you could create a space where someone's comfortable to come home to, that's maybe all I could do. And hopefully it's somewhat helpful at times.
You do. And he does so many things. So he has been staying at my house and he does change. And we have very similar tastes and stuff, and he sees the world a lot different than I do in a good way, and he brings a lot to my space that I never thought it could be improved in these ways, but he manages to improve my space. And so when I come home, it's somewhere where I just am able to relax fully, and whether, it is the lighting or whatever it is, it just feels so much better, and you don't think that those small things make a difference, but they do, and he takes notes of those things and has the eye for it. And so he, brings that to my space, which makes, I don't know, it makes me feel better. And although, he can't necessarily change the things that I see or do at work, but when I come home, like, he can have an impact on that space, and it's really nice.
I hope you can have, that we're in a place where you can appreciate something that's outside of what you're doing every day. And obviously, if I came home and was exclusively focused on, tell me, the day, which I want to hear, but there should be hopefully something that's like, well, I can provide hopefully XYZ, which, I think if someone's in a relationship with someone in residency, it's like, what can you provide that's, not a distraction, but just a different thing going on? Because, I don't want you to come home and be like, I brought work home with me and that's my focus now. It's like, well, my focus is something else. And, maybe I can offer that. Not here's my day all day, but, here's music I found today. And here's, look at this food or this product or something. And, it's giving what you also can care about, and not be in a place where you're not giving something, to you in any way. I just don't want to sit there and be like, remember your day all day and sit on that, and I'll just shut up, I'll listen, and then I'll hopefully give something fun.
He gives me the space for me to talk about my day. And if he doesn't understand it, or he, like, you can't, like, the fetal demise that happened, like, he let me have the space to be upset and to grieve, and giving the space for someone who has gone through something, whether it is medicine related or something else in anyone's life, just giving them the space to be upset and to accept it, their state of being, and then to just be of support for them. And Patrick's learned me so well that he knows exactly what I need. That is really helpful, because I don't have to tell him for this. I don't need to tell him to be a certain way, because he already is that way, and it really just works really well.
I don't think either of us ever tried to change anything about the other person, which, that could be bad if we were like, oh, I wish you weren't doing XYZ. And, maybe we've gotten lucky where there's not much that pisses one another off. But I am always hopefully open to, if there is something, then I should know, and I'll try to curb that. But, it shouldn't be a place of like, oh, I wish you did this. It's like, well, what do you like that I am doing? And, I'll do that more, and hopefully other things less. So
I hope this is helpful in some way. And if you want us to talk more at some point, we can. Bottom line is that if you really care for one another, then it will be relatively easy, because you'll just hold the space for each other, whatever each other are going through, and recognize that there's going to be harder days, and times where you might not be able to console one another. It is what it is, and you get through, and it's fine.
Yeah, you do just keep going.
Yeah.
That's what I've said on any of the hard days. Like, well, the day will end, so keep going. Yeah. And that's very simple, potentially stupid to say, but it's true.
No, it's right. He's right. And I said it in one of my recent videos. I'm like, this shift is going to end in 11 hours. That's good. And I know that. And so he's kind of helped train my brain to think a little bit differently, so I'm not in that dreading, impending doom stage for my entire day.
Happy gaslighting.
No.
It's not hard. It's really good, right?
it. I hope it was helpful. Until next time, take care of yourselves, be kind to yourselves, continue to work hard, and all the good stuff. Okay, bye!